We're going to be talking about melatonin. I hope we're sharing because it appears that we went live. In modern medicine, we're learning a lot about old sciences. Today, what we're going to be doing is we're going to be discussing the issues of melatonin. Now, as you can see here, I'm prepping and I'm getting things going on in the background, but I want you to kind of know that. Let me see if this works. And we are live according to the world. We're actually working. So in this sense, today we're going to be discussing melatonin and its effects on the human structure. Now, a lot has been written about melatonin and a lot of news is moving in the melatonin dynamics. But we're seeing some correlated issues, how melatonin interacts with the immune system, how it interacts with the whole body approach of treating individuals. It wasn't very long before you figured out that in today's COVID world, we were taking melatonin, and it was like, why are people doing melatonin? What does the relationship of melatonin matter in treating disorders? We've always heard that it helps with restoring sleep, but we want to understand a little bit more about the dynamics of melatonin. So I put together my team here, Paola and Kenna, Vaughn, we're going to go ahead and discuss how we treat, how we assess dynamics that may require particularly melatonin in this particular conversation. So today, what we're going to be discussing is we're going to be discussing what the issues are of endogenous melatonin, understanding what it means to be a chronobiotic, understanding the phase shifts and potential exogenous melatonins, and the physiological effects of melatonin. We're going to differentiate between immediate and sustained release. Now, a lot has been said specifically about what is immediate release and sustained release. Well, sometimes sustained release, what that means is it continues to produce a certain amount of melatonin. Depending on particular habits, we may want a spike of it, we may want a continuous release of it, and we have different types of products that release it at different times, depending on the presentation. We're going to do a little bit of review on the literature. We're going to discuss how melatonin affects our aging process. We're going to gain awareness as to foods that are linked to improving melatonin reactions. We're also going to be talking about some lab works that we do, and ultimately that give us particularly the insights as to how melatonin responds in our bodies and what the patterns are of melatonin in our particular dynamics. Finally, we're going to end with the COVID dynamics, which is explain why so many doctors, including the president of the United States, which was at the time Trump, who got infected with COVID, they gave him certain types of antivirals, but they talked about the fact that they also gave him melatonin, and that was real odd, along with zinc and vitamin D. Those are other subject matters, but that was a question. Why was melatonin being given to them? So we hope to clarify a little bit of that information, but we're first going to talk a little bit about what the purpose is of melatonin. But no conversation begins better with melatonin unless we can talk about where it starts, where it regulates our bodies, and where the beginning is that actually it kind of controls us. Now, dating back from hundreds of years ago, you see the old Egyptians have the old third eye thing going on. And what I have to tell you is that much of the sciences that modern medicine understands today can relate back to the early knowledge because they kind of sensed it. There is a feeling that when you do have melatonin running real well, there's a sense of well-being that happens. You feel kind of like your brain is being perfused, and the way your body moves and the way the body reacts to certain chemicals as well as experiences is adapted by early morning experiences. So what I'd like to do here is I'd like to go ahead and give you a little anatomical presentation of what we see is where melatonin is. Now, in terms of where it locates itself, it sits in an area of the brain called the suprachiasmatic nuclei, okay? Now, if you can look at it here, it's this red dot. So I'm gonna see if I can amplify this a little bit better, this picture. It's that red dot, okay? Right there, you can see the pituitary gland sits right here. This is called the hypothalamus area, okay? This is the thalamus area, this is hypothalamus area, so below. Now, the suprachiasma, this is the chiasm, if you can see it on cross-section here. Now, in this particular situation, you don't kind of see it because the brain's being cut sagittally, okay? So what we want to do is we want to do a different type of cut, a different kind of dynamic cut, and we want to look at this particular area where the optic chiasm is. And when you look at from the top, you can see that the suprachiasmatic nucleus is right here, right over the center. This little sectum is called the optic chiasm, so it sits right there. The sensors for the suprachiasmatic nuclei are an area of nerves and endings of nerves that actually can perceive the amount of light coming in through the eyeballs. Those are eyeballs. So what we learn is that right there is where the third eye is. So what they call the dynamics of perceiving light intensity, okay? Many creatures, any lower level animals, they don't have eyeballs. They have sensors, light sensors, where they can see movements of light. And we have, in essence, an area that sets into motion the body dynamics through melatonin regulation that affects the entire body. So as we all know, that if we don't have good sleep patterns, everything gets affected. And what I like to discuss is the connection between the immune centers and the inflammatory centers. Now, we've been watching, and our prior president, you know, the dude never slept, right? So he was tweeting at like 3 o'clock in the morning, 6 o'clock in the morning, 7 o'clock in the morning, literally never slept. So this guy is running on energy that we don't understand, right? Yet he doesn't drink, he doesn't do anything, as far as we know. Okay, so the whole thing is that we got to control this guy. So if he's got the bug and he got COVID, if he does not sleep, what's going to happen to his immune system? It's going to go tailing down, right? So looking at this, you can actually see how this suprachiasmatic nuclei affects the entire nervous system. So from here, you can see the neurons here that are portrayed that perceive information coming from the optic chiasm. So with much of our treatments, we're going to be talking about light therapies. We're going to be talking about the timing of our therapies, and they're going to make a big difference. But like I said, it's one of those things we want to learn anatomy to understand where this is coming from, because it gives a little bit better perception. So from that point of view, I like explaining a little bit of the effects. Now, as you see here, it has a large effect on many organ systems, okay? From the liver to the kidneys to the heart. It's crazy how much the information to the ability of the temperature sensor systems of the body. So as we go through here, we start looking at the dynamics, and let me go ahead and change my picture. We talk about melatonin, okay, as what it is. Now, we know that it's in the retina, it's in the GI tract, it's in the bone marrow, it's in the blood, the receptors to this area, and it's where it's actually produced. And you have secretion is regulated by the suprachiasmatic nuclei. That's what we were just talking about, of the hypothalamus, okay? It's like the master clock. I like looking at it like it's the master third eye, okay, so to speak. Okay, so in that, what we can look at it, we can see
12 o'clock.
Oh, there's my clock. It's also 12 o'clock, guys. Sorry, guys. The drop is dramatic in the AM hours, okay, and usually it's lowered by light, and it has an antithesis or another hormone that it works with, which is cortisol, and it works in inverse relationship with. So light activates the cortisol. Okay, think about this. Now, cortisol lives on our adrenals, which is a little organ on top of our kidneys, right? So it's way down there. Now, it's always talking to the hypothalamus. It's going when do you want to go? When do you want to go? When do you want to launch, right? And the melatonin goes, no, not now, not now, not now, no, stay down, stay down. Cortisol, the increase is going to wake us up, right? And melatonin is going to bring us down. So why would we want cortisol levels to be elevated, okay, in the middle of sleep? So we're going to see that the inverse relationship between cortisol and melatonin is critical to be able to not only launch the sleep patterns, but also launch the immune system, right? And launch the inflammatory system as the way it works, right? So when we look at those kind of things, we start looking at these areas as to when it actually relays. Now, here we have a graph of where melatonin actually elevates at. You'll start noticing that it starts working its way up around 8 o'clock at night, okay? Now, peaking its levels somewhere about 3 to 4 hours later at around 3 in the morning. Now, these are the patterns that we see. Now, what we like to see is that we normal people need to understand that stress and cortisol is high in our world. There is nobody that doesn't have stress now, okay? It really is a moment in time where we all have different, whether it's financial, emotional, just living with people inside your own house sometimes becomes a stressful environment to all of us, right? So what happens is we all have stress. How long the event is will determine our fate, but there's some things we can actually do. Look, we don't need to watch Netflix till 3 a.m, okay? I am also addicted to sometimes watching the pimple lady on TikTok, right? But you know what? I'm sitting in there and it's 4 a.m. and I'm watching pimples being removed. But what does that do to my sleep, right? It totally messes it up, right? So we have to have the ability to kind of go deep into understanding that you got to make yourself go to bed, because not only is it a risk to our present safe return to health, or in our abilities to deal with worldly dynamics that affect our stress system, but it also helps us be able to be resilient and strong. So looking at the melatonin is very important. So looking at the peak levels in the night, it allows us to understand. So when we see this curve, we try to understand that, as you can kind of look over here, you can see that it peaks at a certain point and it starts at a certain point. We definitely don't want melatonin high in the midday, but we do have certain events that cause that. Now, early on in this thing, and we're going to start talking to my nutritionist and my health coach in a moment regarding a little bit of what's going on, but you'll understand that melatonin synthesizes serotonin. Now, this, by the way, is a very interesting dynamic, okay? So melatonin synthesis from serotonin, okay? So here we got serotonin, okay? But we'll also notice in that there's a lot of other cofactors. So nutrition becomes an important component. B2, B3, iron, zinc, all these make a matter of things that alter us and our ability to produce melatonin. A lot has been done with 5-HTP. Sometimes when we have low levels, and certain patients do it, we do have that ability to give ourselves that amount to produce, and to produce a risk or a direction of high production of melatonin. So if you don't have it, we have to look at causes for that. We have lab works that we can actually evaluate. Now, here at the suprachiasmatic nuclei, you can actually see now a more of a kind of a cross section, a pie cut out of the brain. And you can actually see from here, it actually has these little block sensors. But you can see that it actually works on the digestive system. It works on the lungs. You have sensors on the heart, liver, stomach, intestines, sex organs. It is everywhere. So the whole connectivity of this melatonin is vast. It has such large effects that people have not realized it over the last decades, but you'll see through the NCBI, thousands of studies are done per year that actually are working on understanding melatonin. And that is why our president was given it, because the implications are so vast that it actually helps mitigate the cytokine storm, which is the inflammatory excessive reaction of our immune system. So it gives us also a little bit of ability. Now I'm gonna ask a little bit to specifically Anna right now. In your practice of nutrition, how have you seen melatonin play, and what are the kind of things that you see melatonin play a role in nutritional treatments?
In nutrition, well, it has a lot to do with, of course, you mentioned serotonin. So it has a lot to do with all of the mood swings and how the person is interacting with its own environment. So the first thing that I give to my patients, or the first thing that I recommend to my patients, that when they are reporting very bad sleep, or maybe a delayed sleep disorder, or maybe just like a mood phase disorder, is to include tryptophan-rich foods. That is like the first step for me. But of course, there are like a lot of things that can influence the production of melatonin. So of course, you mentioned the light, and now we can see that there are like light appliances that let you obtain enough light. Most of the times, well, we live in the border between Mexico and the United States. So we are like the borderland city, and the borderline sun city. So we have plenty of light. But in that particular case, for example, for night shift workers, this full spectrum light could be like an extra step that I would take in order for them to feel like a little more safe. And there are like a lot of nighttime workers in our environment. For example, nurses, nighttime nurses. So this is like very helpful for them. Another thing is that, as you mentioned before, melatonin is more like it's like a clock master. It's the one that organizes the clock, the circadian clock network, because each and every single target tissue has different melatonin receptors. So when these receptors get activated by melatonin, it means that they have to work. So it actually organizes each tissue, and it says like, okay, you have to work right now. You have to work right now. Cortisol, you have to get up right now, and I'm going to decrease. But it is actually always working. It's always like keeping all of these little clocks organized, and then it passes all of the information to the target tissues, as you mentioned before. So that is like very important part of this melatonin synthesis and melatonin secretion. Another thing is, if you pass to the melatonin metabolism pathway,
Yes.
you can see that, as I said before, melatonin is made from tryptophan, but we need a lot of other nutrients in order for this specific two enzymes to function. The first one, that is this hydroxylase, tryptophan hydroxylase enzyme. It has to work with iron, it has to work with vitamin D. So if there's like a deficiency right there, we will have problems turning this tryptophan into 5-HTP. Another thing is that if we're missing the specific nutrients that decarboxylase this 5-HTP to serotonin, then we're gonna have another issue right there. So of course, then we have serotonin, and this is going to be like very important in depression, in anxiety issues, and all of these prevalent conditions that we're having right now. And we have to take some of these other nutrients. So supplementation is really important. Vitamin D is really important. The assessment of the iron status is really important. So I have to go deep into the nutritional history and know exactly where is it that it's going wrong. What is the nutrient that I'm missing? What is the enzyme that is not working, so that I can supplement something better to my patient. And after that, start working with other treatments like the light, which is like a very important factor right there. Even more so for teenage students right now, which I think that it must be like really difficult to be a student right now. Just picture being in front blue light all of the day, and then trying to, I don't know, get distracted and be on your phone the rest of the day. So of course you're gonna have a circadian rhythm movement right there that is going to be deleterious for this patient. So please open a window, stay outside for 20 minutes with a lot of sunblock, but do something. Just don't stare all the day to your computer or your monitor right there.
So one of the things is that when you mention that, and we look at things like circadian rhythms, you can see that light plays an important component. Now, you mentioned vitamin D. Okay, well, vitamin D is really picked up by or activated by the skin. So light on our skin sensors also relates back and forth, and it assists the process and is a cofactor or even a direct enzymatic or direct factor that influences melatonin. So when we start seeing this, we start noticing that it's very, very important. Now, digressing a little bit from the way we see it in our physical medicine type of practice, we may see a person who is, well, to say the least, well nourished, and they are probably have a BMI well higher than what normal would be, between 25 and 28 or so, and they're at 36 or 40s a BMI. Well, sometimes what we know is that there may be implications of extreme stress. And the person tells us, well, their weight goes up and down. When you see somebody's weight going up and down, we look for hormonal imbalances. We look for stressors that are affecting the individual, such as cortisol. Now, just following that line of attack, what we do is we want to see what are the effects of cortisol. Well, when we deal with cortisol as an indirect effect of excessive cortisol, we have a friend, a little monster, green monster comes out called insulin resistance, right? So when we notice these insulin resistance, we start noticing things happen that people start getting bigger. And when I say that, we have to kind of look at it from a point of view that when we look at dynamics, we have systems in our office where we evaluate body composition. So body composition, or someone has an excessive amount of body fat, for example, in this particular situation, this is me, so don't worry, no HIPAA issues. But if we see someone with a elevated body weight, or a system where body fat mass index is high, we have to figure out what's going on, okay? So we not only want to look at things from a quantitative point of view, but we also ask qualitative point of views. How's your sleep? How's your pattern? How's your libido? All this gets affected directly, because a lot of people don't realize that libido is ultimately implicated. And here you go, okay? Even that system is affected directly from the suprachiasmatic nucleus that actually produces the hormone of melatonin. So what we see here is that when God created us, he's created this really interesting dynamics, not maybe a direct link like the vagus nerve, but these hormones that actually meander to organs and launch them at different points. To your point, Anna, it's amazing to know that the liver is also asking the question, are we ready? Are we ready to launch? We want to begin this metabolic process? Does the stomach want to start producing acids in the middle of the night, right? Or does the it depends on digestive processes. So a lot has to be done by understanding that this melatonin has a huge reaching effect. So stabilizing its rhythm is critical in figuring out what's going on. So let's take a look at the rhythm here, okay? So when we look at the overlapping circadian rhythm, we look at the normal methods. Now, one of the things is we just want to look at certain components like core body temperature and plasma cortisol. You're going to notice that as melatonin rises here, right, you're going to have its friend cortisol goes down, okay? Because this one is controlled by your adrenals, okay? Those are your little bean-shaped organs in the back. And they're signaling the brain when, because we got to launch. We got to get this guy to go get some food, do what you got to do to survive, right? But melatonin says, no, it's not time. You need to do something. You need to rest. So as you can see that they're both inversely related. It's very interesting that the core body temperature actually goes down inversely related to also the melatonin. And that's going to come into effect later, because we can actually help mitigate the core body temperature by the amount of dose that we can give an individual with melatonin. So when we go there, we can actually see that. So what we're starting to learn today is that because it's a phasic thing, we want to understand the phases of that. So what I'm going to ask Kenna in a few moments is to discuss a little bit about the labs that we're going to be going through, because what we're looking for when we do labs is normal pattern distributions from a melatonin dynamics, okay? So I'll give you a preload of what we look for here. We look for patterns and changes. So, but before we go there, I'd like to go ahead and just kind of discuss exactly the early phase, or what we call the advanced phase melatonin reaction versus a delayed phase. Now, tell us, now you know a little bit about this, Anna, a little bit, or where's Anna? She's zapped out. Okay. So, well, I'll go ahead and explain. What happens here is that we have melatonin at early phases. You can, oh, there you are. Okay. So, can you explain a little bit about the early phase versus the delayed phase of melatonin reaction? Yes.
Yes, I can do that explanation, but I think that I'm gonna need an example right here. Well, it has a lot to do with the sleep hygiene. So for example, there comes like this patient that says, hey, I I just crash right after I have my lunch hour, and I have to sleep. And most of the times I get like I try to get a nap, like a 15-minute nap, but it turns out that I just black out for 2 hours. So this means that our melatonin peak is already like changed. Our phase or peak phase is already kind of advanced, or it could be delayed. This could actually happen in those patients who wake up and they are so tired. They wake up at 8 a.m. just saying like some type of hour before they go out of bed, and they feel so tired, and sometimes they want to get back and sleep. And this means that the phase of the melatonin secretion is actually delayed, and they are secreting that larger amounts of melatonin right after the 2 a.m. to 4 a.m. peak, right there when you are where you are signaling it. So this means that, well, there could be like a lot of things, but it has a lot to do with the amount of time that we spend looking at our monitors, or the fact that we are not going out of our house. So the lumens, which is like the measurement of light that we are getting through our retina, is not properly being there you go. It's not properly being
distributed,
or it's not activating the secretion of melatonin the way it should be secreted. So sometimes, or most of the time, again, the screens, the full light screens, are like the ones that really help. The light screens, the therapeutic one.
So let me ask you this. So what we do is that the full spectrum lights, these lights actually suppress the melatonin reaction for a later time. So we want it to be coming out at the right time. So by using these lights, we suppress very much so if we want to make sure this thing comes out at a later date, if it comes out earlier, right? Correct?
Mm-hmm.
Got it.
Yeah.
So that's how we're looking. But
yeah, it works depending on the diagnosis. If it's like an advanced phase rhythm that we have there, or if it's that delayed phase of the melatonin secretion. So the main thing that we have to do is that we need to have a routine, because most of the time you can see right here that the melatonin production mainly increases when the sun starts to come down. So we have to make sure that our body is getting that signal and that language that we need to start producing melatonin in order to rest.
Got it.
But of course, stress and cortisol, it's going to inhibit this particular hormone right here, because they counteract. So we have to take like we have to do like a very close assessment of the cortisol release and the melatonin release that we are having, and how they are interacting with one another. Because as you said before, melatonin is like the first signaling pathway that will lead to immunological factors, to the hydrochloric release in our stomach, and all of the protection of the gastrointestinal tract that comes with carbonate that actually gets released by melatonin in the duodenum. And another thing that actually gets controlled by melatonin are anti-inflammatory or interleukins that will actually modulate the inflammatory response that we're having. So,
like when you say that, the immune modulation by those immunoglobulins, or IG1s, IG2s, IG3s, IG27s, these all have the ability to respond based on even the melatonin influence. Tell us a little bit, Kenna, if you're able to do that. Are you able to connect there regarding the labs? And if not, then I'll continue to do this. We do labs from doctors' data that help us and this is only one of the companies that we're using to be able to assess where your melatonin reaction is. So we have two choices. One was which is it is actually the serum. Also, we have saliva, because one of the things is that the saliva also lets us know how much the melatonin is, how much cortisol. So today, the circulatory system is very much linked to even saliva production because of the glands. So we can actually see and measure where the melatonin versus cortisol is using diagnostic testing procedures from Dutch test, along with the doctor's data melatonin reports. So tell us a little bit about that, Kenna, if you may.
Yes. So this test actually is going to be done with 4 separate saliva samples. That way we can really watch throughout your entire day what's happening, where your levels are spiking, and when they're going down. Sorry.
I love this. I love this. Women under stress. I love that. Hey, I wonder what the cortisol level is on you now. Go ahead, continue. If you can, if you can't, okay, she can't, that's okay.
Okay.
So when she was doing that, you can actually see is that we all have the dynamics of stress. So having kids of my own, you know what, we just know how to tune that out, right? By the way, have you ever been able to deal with, or to be able to see how parents sometimes have a kid screaming and they just can have a normal conversation? Because I know that there's an ability, a third ability, an instinctive ability to tune that out. But anyway, we sometimes, but on audios, we kind of gets corrupted a little bit there. The idea here is to be able to see exactly where the melatonin should rise. In this particular dynamics here, we have an individual where their normal melatonin should be rising in the evening time is actually low, okay? So here's a problem, because the individual can't sleep. Well, they come in with increased amount of body weight, and they've been having stress the entire time. Well, here's the crazy part about it, right? Well, not only does the stress create inflammatory reactions, but constantly it allows for insulin resistance. And what we see is an individual that's not only in pain, but is also overweight. So what we look at is when we evaluate these dynamics, we can see that the connection in functional medicine is to be able to connect the dots and be able to ask the right questions to determine how can an anthropometric measurement of body fat analysis, how much water they're retaining, extracellular water, because all the systems are controlled by melatonin to some extent. The wisdom is far beyond. We're just learning as we're getting this. Again, 20 years ago, melatonin was the thing to reset your time clock as you were flying on an airplane. Today, we're seeing it actually being used for COVID. So what we, as a mitigating factor, as a supplemental treatment to preventing a cytokine storm by modulating the immune system and keeping everything in check. It's amazing how good things are free in this world. So the dynamics of this is to be able to assess that. So our laboratory test, whether it's through Dutch or through doctor's data or through other companies that we use like Vibrant, we can actually determine exactly where your levels are. Because one thing is me talking about it. One thing is an individual presenting, but we really need to prove this. And we need to be able to see quantifiable changes in the dynamics to be able to see exactly what we're going to do so that we can correctly change and modify the diets, okay? Because once we do that, then we realize that stress relieving factors, lifestyle changes, food dietary changes, the circadian rhythms of the human, we have to protect that in today's world, because those people that run the clock the wrong way, those people that eat the wrong way, those people that have constant elevated stress and have a real high BMI, man, we're looking at a perfect storm of a dynamics where the person can be very vulnerable in this time today, and what we call the COVID era. Now, let me go back into the presentation a little bit as we kind of digress a little bit. But Anna, you were talking about the lux. Now, the ability of light to be in our system is to suppress the melatonin and to allow it to come out at a different time. If you teach it and reset it with light therapy, you can actually time the melatonin. And when it doesn't get produced or it gets produced too late, we can bring it in by taking supplementation. Okay. So there's other things that we can do, but it just goes to show you that when we measure, we actually see that if you work inside a rainy day, this is how many lux you need. You need 100,000 lux. Okay. So this is what Anna was talking about relating to a indoor light. Now, if you work indoors, you don't have enough lux to, or the measurement of spectrum light to be able to suppress the melatonin, and the darn thing just floats around, making you, kind of like messed up. And when it needs to trigger, it doesn't trigger appropriately, if that makes sense, right? So when we do these, we have these products here that we use. Now, the ability to suppress evening light becomes important. Now, dosing in therapeutic areas. Now, one of the things that we've looked at is when you go to the store, you start noticing, melatonin products that are out there that start at between 2 to 3 milligrams, okay, of it. Some of them are even up to 20 milligrams. Now, one of the things is that we're not too sure at this present time, does melatonin actually cause the activation of the sleep dynamics, or is it the mechanism that opens the gate? If it's the open the gate dynamics, that's why the new theories are using lower doses that actually open the gate to allow the process to mitigate itself and to present itself. So we really don't need high doses, as we're starting to learn, because at high doses, we don't have much more effect than we have at low doses. So the best option in medicine is always to use the least possible treatment dose that actually works. So when we look at these, a little bit about dose comparative studies, we can see that 0.3 milligrams, okay, to 0.5, that's half a milligram, is as effective at reducing sleep latency in age-related insomnia as 3 and 5. So why do that? Why tamper with the system? So use low doses. Now, 0.5 milligram versus 20, more effective at regulating circadian rhythms in the sighted person, okay? So what we need to do is we need to be able to know the difference between using 0.5 to 20 milligrams. The higher doses also change the body temperature. Now, what does this matter? Because when someone says to you, hey, you know what, I wake up really, really sweaty, and in the middle of the night, I'm just hot, right? And that may be because it's metabolism or just because their circadian rhythm is off. Well, the ability to take a little bit elevated melatonin will actually suppress the body core temperature. Now, you'll remember here that if you see here, the core body temperature diminishes based on the ability to also increase with melatonin. So if you see this number go up, you most likely will see that number, or the red one, which is the core body temperature change, which is indicative. And when we look at sleep studies, when someone sleeps in a cool room, usually around 65 degrees, they get more ability to, to go into REM, okay, which is the rapid eye movement, which all metabolic processes kind of like start repairing and fixing the body and dealing with it. Now, no matter what we do, no matter how we treat people, there is no way to supplement away sleep. Okay, like I can take a vitamin D to avoid sleep, or take this to avoid sleep. No, our body needs sleep as a normal dynamics, and we must be understanding of that. It's 12:30. We'll edit that out. So as we look at that, we need to see that the most important thing is to be able to get the rhythm to work properly. Now, I know Kenna was in the midst of kind of talking about this. Did you want to go that thumbs up, or can we do it? Or what is what does our guy say? Go ahead.
Yeah. So this test, like I was saying earlier, is made up of 4 different saliva collections. The first one, the individual will take 30 minutes after they wake up. This is going to be a great way to see what's going on in the morning, if their melatonin is coming down, how high it is when they wake up, things like that. When we take these saliva tests, we're going to want the individual to rinse their mouth out with just plain water about 10 minutes before the test. That way, the melatonin that we are collecting in the saliva is pure. It's not being influenced by any foods that they ate, or toothpaste, toothbrush, things like that. So the water is going to be a very important factor in this test. The second one that the patient is going to do is going to be right before lunchtime. once again, we're just seeing where their melatonin is in the middle of the day. The third one is going to be before dinner. And the fourth one is going to be right before bed. So with these 4 collections, we get these graphs, these points that are marked on the graph, so we can track, like I was saying, what's going on throughout the day, where their rhythms are going, how can we improve those with either melatonin or maybe by getting some different light into their system, as Anna was talking about earlier. All those things impact sleep, which is highly, highly important. And this is a great test to do. We can even repeat it in a few months to see if there are improvements with their cycles.
That is awesome. You know what I want to ask our resident breastfeeding expert here, Ana Paola Rodriguez Arciniega, of the importance of melatonin, because right there we have right now a young lady who is at a special moment in time, Kenna Vaughn, and there's our little child, Landry, who's really benefiting from a huge amount of melatonin. Let me ask you, what is God is in, let's just look at it from a holistic, a spiritual sense of our Creator. Okay. Why would God give melatonin to a child, and how does that work?
Well, it actually works from the beginning of the life conception, I might add, because melatonin is one of those hormones that can easily pass the placenta membrane. And as we know, it's kind of a barrier right there that allows something to enter and something to stay. It just keeps it out. So melatonin is like one of the hormones that can easily pass through the placenta's membrane, and it's actually part of the baby's environment from the second that the conception is done. But something that is really important right here is that after birth, there is also melatonin concentrate, like high levels of melatonin concentrations in the, number one, in the colostrum, the first 4 to 5 days of the colostrum intake of the baby. They have like very large concentrations of melatonin, and breast milk has like a very large concentration of melatonin in the nighttime, while in the morning it has very low concentrations of melatonin. So it actually changes. It has a circadian rhythm. But there is actually something, and I guess that all of the parents won't let me lie on this, is that the first 3 months of life, the baby's circadian rhythm is all over the place. And it seems to be like this kind of thing that the baby is not fully getting the melatonin or fully metabolizing the melatonin. It's just like right there getting ready to function, but it's only going to start to function after the 3 months of life. So that is where when the baby starts to sleep like a 6 to 8 hours kind of night sleep or something. I'm sorry, I don't have babies. I just know things about babies and about breast milk because I love that topic. But that's actually how it happens, and it has a strange way of functioning, but it's right there for the baby to start knowing what are the circadian rhythms and how is it going to work when they finally, when the receptors, the M1, M2, and M3 receptors start to take all of that melatonin in, and they start to function correctly.
You know what? So let me ask you, from a study point of view, how does Landry, just using that dynamics and using the dynamics can you see the difference when breast milk is given to your baby? Does it go out? Is nap time coming from an actual live study here? Go ahead.
Yes, she is on a nap schedule and a sleep schedule. So around the same time every single day when I feed her to go to bed, that's the feed that will put her to sleep, versus when she wakes up and eats, she stays awake during her wake windows. Another thing that you can do to help babies learn their rhythm is when they wake up to feed them by a window. wants to tell you herself.
Yeah.
So that's right. So tell us, Landry.
To feed them by a window when they wake up versus to feed them in a dark room to go to sleep. That helps them as well.
Yeah. And that is something else that helps in the last feeding, breast milk feeding that you're having with your baby late at night. It should be with a dim light or just in a kind of dark room in order for them to be like calmed down and be able to sleep, have a better sleep. So yeah, that's actually what happens.
What I gather from this, and as we get deeper into this thing, we're going to start seeing that that melatonin has far-reaching effects that are beyond just sleep, beginning the sleep pattern. This is setting the immune system and all the things discussed into motion. So we actually see that this is how it began many years ago, where it was being given to people for jet lag. You fly to Spain from America, you're in a whole different time zone. Okay, so you need to reset your time clock. And this was a fast way of resetting it. But it was confusing, okay, because people didn't know when to take it, how to take it. So based on these studies, we now know that there's an appropriate mechanism and a timing structure to take. Now, I do believe that we have even a timing cycle, but we'll probably discuss that as time goes on. But let's go ahead and talk about a little bit. Let me go back here. And we were going to go melatonin dosing and went to therapeutics. The effects on women seems to be a little bit more improved. I mean, women get affected more by melatonin and quality sleep. The significance of within 6 to 8 weeks of supplementation, improvement in quality of length of sleep. So we do it for a period of time. When we do that, can you give a little bit of kind of instructions that you give the patients when you do this? Anna, tell us a little bit about that.
Well, something that I say is that it depends most of the time in the quality of melatonin that you're taking. Most of the time, people just grab an over-the-counter melatonin supplementation bottle and they pop it right in. And first of all, sometimes it has like the higher dose of melatonin, and we still do not know how it properly works and why a higher amount of melatonin sometimes is not efficient for this patient. So we have to take into account that the first thing that we have to do is to provide the patient with proper supplementation and a medical grade melatonin supplementation. That's like the first part of it all. The second part is, of course, the vitamin supplementation that comes with it, because melatonin will be like the last step of the process in the metabolic pathway. But we can improve it by keeping the tryptophan supply in a very good level and provide all of the vitamins that serve like cofactors for those specific enzymes that we talked. Another thing is that it won't work directly, or it won't work just like, okay, you're taking melatonin today and you're going to fall asleep right after that. No. Most of the time, the patient has to be very patient with it, and it takes about 6 to 4 weeks for it to finally have like some effect on it. Something else that we have to talk about is the time or the sustained release of these specific melatonin supplementation. So sometimes they take like a fast-acting melatonin, and they need to sleep like 15 minutes after they take it. So yes, that's something that you have to take into account. But are you waking up 4 hours later in the middle of the night? What is happening with that fast-release melatonin that you're taking? And this has a lot to do with the diagnosis of a delayed phase or a like alternative phase melatonin release. Another thing is that if we talk about fast-acting melatonin, we have to talk about the sustained release melatonin that actually works 60 minutes afterwards. It is taken, and it can last like 4 to 8 hours. And another thing, of course, is the metabolism of melatonin. Melatonin has to go to 2 ways of metabolism. The first one is the liver, and the second one is the kidney metabolism. And it gets like out of our body real fast through urine. So we have to take into account that we can actually assess melatonin by an urine sample, but it's easier to do it with the saliva testing.
I'm going to digress a little bit because that's very important information. We're starting to notice that people who have parents or older parents that live, to find out when we should start taking this stuff. When is it appropriate to the life cycle to a child, puberty, and aging? Okay, we first have to look at the patterns, and when we look at that, we see that melatonin is heavily produced when you're a child, right? But you can actually see that somewhere around the 40s and 50s, it starts affecting. Well, that's really when people are working. That's when people are trying to build their future. This is when you start waking up into life and start saying, you know what, I have to plan my life better. I have to redirect, and worries come in, right? Well, this is where the time where people stop sleeping well, their patterns, their workload increases. And what we got to do is we got to be able to educate our patients to understand that there's a normal process of change through the normal melatonin release dynamics. We all have those who have lived with grandparents wonder why grandma wakes up at 5 a.m. She's like earliest to wake up. And it's like, Jesus, man, where grandma, you don't sleep. I have a story, as I was sharing with my staff earlier, is that when I was younger, I was in my teens, somewhere around here, my dad would look at me and goes, man, are you taking drugs? Are you sleeping all the time? What do you do? And I was like, no, I'm not taking drugs. I just love to sleep. And those of us who have teenagers in our home realize that they love to sleep and they enjoy their sleep. And in today's world of COVID and working from school, school is home and home is school, we realize that many of the kids are in their beds and they're sleeping and their patterns are thrown off. So we can see that at an early age, you can see that when you do have those dynamics in this particular area, when you're in your teens, you can see that it does affect if sleep patterns are derailed. As we look at the areas, things that affect, actually melatonin release. Maybe you can add a little insight into this, Anna, specifically because you do dietary changes. What do you look for things to make it produce better?
Ooh, that actually fits a lot with a nighttime routine, which I like to call it. So yes, of course, alcohol before bedtime works like a fast-acting melatonin kind of supplementation, but it will wake you up like 4 hours after. And I'm not telling you that you should test it, but it actually happens. So
what you're saying that alcohol starts you sleeping better and then it wakes you up. Got it.
And then it wakes you up. Yeah, like 4 hours after you take it. So don't ever do that. That's like very bad for your sleep routine. Another thing that you mentioned is that most of our teenagers are actually starting from their bed. So that really messes up the fact that we are we're admitting that our bed is not to rest, it's to work, to rest, and to watch TV and to spend some time in the phone and maybe even eat at your bed. No, the bed is only for sleep and for something else that starts with an X. So that is like the thing that you need to focus. Another thing that you actually mentioned, no, that's very important. And another thing that you mentioned is that we need
another podcast here. We got sex and melatonin. I think I want to go.
Yeah. It's very important to keep your bed as a sacred place, and it only works for that. And the other thing that you mentioned is the temperature. We have to keep our bed setting or our room in a very cool temperature kind of way. You mentioned 65 Fahrenheit. Mm-hmm. So that would be like a good temperature for your room to be in. Another thing is that maybe keeping your dog in your bed is not probably a good idea, just in case that your dog snores or passes gas and it's like very smelly. That is not a good idea, actually.
Oh yeah.
What is it?
All right. we
So
got it.
if we're having problems with your sleep routine, you're gonna have problems with your melatonin secretion. So I think that all of those specific points lead to that final point right there. That is very important. We need to keep a nighttime routine. We need to stop drinking coffee right before we go to sleep. If we feel that coffee will accentuate our activation mode. Another thing is that chocolate is probably not a good idea for the melatonin release. Teas is actually a good precursor of melatonin because we have found that like chamomile tea and green tea can actually induce better sleep. So we can use that. And maybe just to mention is that wine can actually induce melatonin production. But as I said before, high amounts of alcohol may lead to a fast sleeping mode and then will eventually wake you up in 4 hours. So just like rupturing that cycle right there. So there are like a lot of things that we have to take into account in order for us to have a better sleep in this time that we are living, which is like the COVID time.
Let me ask you this. In terms of types of dietary changes, I have up here a study on melatonin and the Mediterranean diet perspective. Tell me a little bit about how you edit and you change people's, or maybe work on people's diets, specifically in your world of melatonin. Tell me a little bit about what you do.
Well, something that we need to discuss over Mediterranean diet is that it is rich in phytonutrients. And phytonutrients are very hard to digest, and they spend most of the time in our upper gastrointestinal tract and lower gastrointestinal tract. So what I mean with this is that they spend a lot of time interacting with our mucosa and with our microbiota. And why is this so interesting, and why does this have to do something with melatonin? It's because, as we said before, melatonin is secreted by the pineal gland, but actually, like most of the melatonin is secreted by the GI tract, like 400-fold more. So that is like very important part of the phytonutrients that we can find in the Mediterranean diet. Another thing that actually serves a good function in the terms of Mediterranean diet is that it has a lot of fish content right there. And fish is rich in tryptophan, which will actually lead to a better synthesis of melatonin and serotonin. So it has a lot to do with the macronutrients, the phytonutrients, the amino acids that it possesses, and the interactions of the metabolites with our gastrointestinal tract and how they will ensure the signaling and how it will serve the melatonin to keep working. Another thing is that the Mediterranean diet is rich in omega-3 fatty acids. And we just stated that melatonin is like the first step of our circadian rhythm, but it would be like, why are you supplementing melatonin if you're having such an awful diet? But if you keep your melatonin supplementation, change your diet to a Mediterranean diet, it will actually improve the anti-inflammatory effects of melatonin with the high intake of EPA and DHA from the Mediterranean diet, and they will act together. So that is like a plus point right there with the Mediterranean diet and the interaction with the melatonin that could actually help and improve.
Clearly, the Mediterranean diet it has far-reaching effects, and the studies of it relating to the melatonin, huge effects and huge relationships. We realize that the diversity of the phytonutrients is what is important in this dynamics of Mediterranean diet. just from the phytonutrient side of things. So when we have a very colorful type of diet, or types of fibers, such as, if you can imagine going to, let's say, a salad place, hopefully it's a Whole Foods or an organic place.
Sprouts.
Yeah,
Yeah.
Sprouts. Yeah, well, yeah, Whole Foods. Why don't I go over there? Right. So sorry, because we don't want to. But you want to. The whole idea is to understand that the variety in colors is what our eyes are geared to look at. So the more variety of color helps us in our diet. So I know we've covered a lot today. Okay, and what we're going to do is we're going to continue this on the next time around. And what we're going to go ahead and we're going to focus on the COVID relationships of the melatonin. And we're going to have to find out a little bit more about what Landry has to say about these diets, specifically in high melatonin, because I think from what we've learned today, melatonin is important to Landry. So it's very important to that. So I was coming up ways that I could get melatonin, but I think my lady's going to hit me for that. But there's a whole different dynamics there. And your comment, which is another podcast, I think, or presentation, is the relationship with melatonin and what you were talking about, the other thing that relates to using the bedroom for, right? So we'll go discuss that, and we'll get a point of view that's important. So we'll leave it there today. I appreciate having you guys here. Landry, you're amazing. And one day Landry's going to see this thing and go, man, mom is cool, man. Mom keeps it under control, under fire, under hellfire, so to speak. So she does very well. So thank you, you guys. Stay on, and then we'll disconnect, and then we'll reconnect in a second. So stay right there, guys. I got a way of killing the podcast without losing us. So thank you, guys, and thank you, Ana Paola Rodriguez Arciniega and Kenna Vaughn, for your insights into melatonin. We look forward to talking a little bit more about this, and we will chit chat. So let's get it on in a second there for part